Hoje eu tenho aqui para vocês uma surpresa e um assunto que é muita gente tem muita dúvida. Urologia. Médico maravilhoso. Eu trouxe o Dr. Christopher Walker, mais de 20 anos de experiência, para tirar todas as nossas dúvidas, para entender como funciona esse especialista aqui nos Estados Unidos de urologia. Quem é que ele atende, quem é que ele ajuda, quem são as pessoas que precisam ir a um urologista. É só para homem? É para mulher também? Vamos já saber. Dr. Christopher, I'm so happy to have you here with
Thank
us
you.
at VFB Insurance. I appreciate you take your time. I know you're very busy schedule to be here with me today. Thank
I'm very
you
honored
so
to
much.
be here. You're the best, so I have to be here.
Thank you so
I'm
much.
honored.
It's so
I'm very
nice.
honored.
And Dr. Christopher is 20 years urologist here in the United States. And we have a lot of questions for you.
Sure.
One of those most common questions is like, I will read, okay?
It's okay.
In the USA, is a urologist just for women, or just for men?
That's a good question. So in the urology is for both men and women. And I treat both. The most common for me is to treat for women. So I am a female urogynecologist,
Okay.
but I also take care of men for specific areas,
Oh, okay.
which we will discuss.
Okay. So some more new things here, so you're gonna learn. Are there urologists only for women and only for men? Is it different?
So as a urogynecologist, I take care of gynecology, but also I take care of female urology. So you have gynecology and female urology, therefore I'm a urogynecologist.
Urogynecologist.
And there are not many of us, so I can take care of women for the gynecological problems, the usual issues. Also, as a hormone specialist, I've studied to master the area of hormones for
Wow.
both men and women.
Wow, that's very good. That was my second question. So, what are some frequent questions to receive from female patients and from male patients?
So, very commonly, patients for women, the very common problem is the issue related to hormones.
Okay.
Women have a lack of energy, they have a lack of libido, they have loss of muscle tone, and also hot flashes and the
Ooh.
menopausal symptoms or hair loss.
Oh.
Those are a
This-
lot of hormonal issues.
It sometimes it's so simple to be resolved.
Yeah.
Just going to the right specialist, the right doctor, get the right treatment, and you look beautiful again.
Very true. Like you.
Yeah,
You're so
I'm glad I
beautiful.
have a good doctor friend.
You don't need me. You're naturally beautiful.
Oh, thank you. So let's go to the third question. Which treatment is the most demanded by your patients?
That's a very good question. The very common request for both men and women is the issue of replacing hormones. I am a big proponent and advocate to replace hormones with natural hormones. We call them bioidentical hormones.
Oh.
And I like to deliver them in the form of pellets. So we do pellet therapy for both men and women to replace the hormones. It makes you have excellent libido, very good energy, good hair, no more hot flashes, and your moods are very good. It addresses issues related to depression.
It can't save a marriage.
Very much so. Very much so. I have a lot of patients who give me a bottle of whiskey because
Save the
their
marriage.
marriages are saved. So that's a very good question. And the very important thing is that I try my best not to perform any surgeries that are not necessary. So I believe in natural solutions. And one of my most common natural solutions that really help my patients is to perform the hormonal replacement therapy. And as I said, I do it for both men and women. Men over the age of 40, in my opinion as an expert, any man over age 40 should start seeing me.
Okay.
Women the same, because the hormones start to change. The tummies start to get bigger, they start to get fat. It's hormones. Start to get fat here, right? You can't see your toes.
Oh, that is another sign.
Okay, that's not a good thing. Your hair starts to recede.
Oh.
And then you start to feel tired, you're snoring, you get the neck fat here. So you start to snore, you're not sleeping properly at night.
So it's simple, it's not complicated. So what is the process?
The process is you come into my office. I like to use and get lab tests, blood tests, to be precise, to be scientific. And so what I do, I get a laboratory analysis of your estrogen, your testosterone, and your progesterone, the three major hormones. Once I get a snapshot, then I dose your body to make you like when you're 20 years old.
Wow, I like that.
So this is true anti-aging medicine, right? This is what I practice, anti-aging medicine. I'm reversing the hands of time.
And
look at your face, look at your skin. You have beautiful skin. Well, if you were not, if someone doesn't preserve themselves, if you don't take hormones, within 10 years, you're going to start seeing the wrinkles coming in, the hair. You will be in the shower and then you're going to start losing the hair.
That's sad.
Right? So instead of getting to that point, you want to prevent it.
You prevent it.
That's why you have to see me. For the men, very big issue is the issue of being able to perform in bed, right? The issue of erectile dysfunction.
Okay.
It's a big issue that as a man, we have to prevent that after age 40. How? Hormones. Because if you have a low testosterone, you have poor blood flow.
So it doesn't work.
And it doesn't work. It needs to work. If it doesn't work, well...
And let me say, I have clients that have like 3 kids, 4 kids. They don't want to have more kids.
Yes.
So what do you suggest? So they have a lot of hormones.
So they have a lot of hormones. So then they need to see me for us to do some sort of contraception.
Okay.
We have different options. You have surgical and non-surgical options for both men and women.
Okay,
right?
That's good.
For the man, an easy procedure is a vasectomy.
It's
vasectomy
easy?
is easy.
A lot of men is scared of doing
No, it's easy. It's a simple procedure in the office. Very simple.
Office?
Very
get in, get out.
Get in, get out same day. Now you can't have sex for like a one week, to rest the area.
Or else you're gonna get.
Yeah, it's painful. Yeah, and you have to wait for at least a month because the sperm are in storage, so it takes a while to get them down to 0.
Okay.
For the woman, a very easy procedure is something called an IUD. An intrauterine device.
Okay.
IUD. Takes me 5 minutes to put in there.
5 minutes.
And it can no more babies. And it is just as good as tying the tube.
Really? That's very good.
And it lasts up to 5 years.
Then every 5 years have to change.
Yes.
And don't worry for 5 years.
No worry, and you can have sex anytime. A bonus is that the menstrual period becomes very light.
That is a bonus.
A lot of women have no periods because of it. So it's a big bonus.
Okay, that's good. See, that's why when you talk to the right doctor, so they can tell you what's the best thing for you. Each case is a different case. So, vou falar em português. Essa é a importância de você ter um bom médico. Toma seu tempo, que te explica. Olha, vamos checar seu hormônio. Tá alto, tá baixo, precisamos repor. Tem muito filho, não quer ter tanto filho. Vamos fazer um procedimento, vamos colocar um DIU. Vamos fazer uma vasectomia do seu esposo. Não more filhos. Aqui nos Estados Unidos todo mundo quer ter 3, 4 filhos porque é mais fácil do que no nosso país. Eu tenho 4. E eu já já fechei, então não mais kids para mim. Mas muita gente que ainda tá jovem, não quer ter tantos filhos, um bom médico, um bom urologista para fazer esse procedimento. One more question.
That's good.
What is the importance of doing a cervical cancer screening?
A cervical cancer screening is otherwise called a pap smear. Very important.
Very important.
Because what we're trying to do is have patients come in every year, once a year, and it's a very quick procedure whereby we put a speculum in, and what we are doing, we are getting a sample of cells from the cervix to see if there's any pre-cancer or cancer. But early detection is a key.
Is a key.
Because if you catch pre-cancer, which is what most people have,
it's easy to treat.
It's easy to treat.
So the prevention is the solution. Prevenção é a solução. Right?
And the same for men. Men need to come in for their PSA. It's a simple blood test.
A PSA.
If I get a blood test from a patient and the PSA is high, that's concerning. Then I have to do an ultrasound to check for the prostate cancer. But again, that's something that we can prevent.
That is a good thing because a lot of people a lot of men don't like to go to the doctor because they think in the old way they used to do it. The men know what I'm talking about. What's the test you say PSA?
PSA.
PSA.
A simple blood test.
A simple blood test can detect if it's too high or it's too low. So what is have to do?
I want to see and make sure it's normal. If it is high, then I'm going to do an image, an ultrasound. And we go take it from there. But most cases, it's normal.
It's normal.
So that gives you peace of mind.
Peace of mind.
And I'm not going to have to do any exam. I know they're worried about an exam. Listen, I'm a man and I don't want that exam, so I'm going to treat you the same.
That's why it's going to have the right doctor to take care of you. It's a simple, it's don't hurt, it's just a blood test.
Correct.
And then you're gonna have peace of mind. What is the recommendation in order to complete a mammography?
That's a very good question. In the United States, most recently, actually 2 weeks ago, new preventative screening measures were now advised. So women over age 40 are now being recommended to have mammograms. Personally, I recommend a woman over age 40 to get an annual mammogram.
Seu seguro, seu plano de saúde cobre todos os exames preventivos. Cobre homens, o teste de PSA. Mulheres, seu teste de mamograma, seu Papa Nicolau é coberto pelo seu plano de saúde. Você não vai pagar nada. E a prevenção é a solução. E ir um especialista. A lot of women prefer women. So you're good, very good gynecologist. So how you help these women get in your office feel more comfortable?
So that's a good question. I, as a man, can only empathize with a woman. It's not comfortable. It's an unpleasant process. So I establish a bond, trust, building trust with the patient, looking the patient in the eye so that she begins to understand I'm here to help her. Then I never rush my patients. I'm always addressing any questions, any concerns. The patients are welcome to bring their husbands or boyfriends. They're welcome to be in the room. There's always a nurse in the room. So there's never any opportunity for a patient to feel uncomfortable. And with my years of experience, I know exactly what needs to be done. My exams are less than 2 minutes in duration, and I'm able to accomplish what I need to examine. And my patients tell me that my exams are very gentle, because as a man, I can only imagine. So then I make sure it's brief, very concise, and gentle. And I do it in an environment that is very clean and safe. My nurse she's from Brazil, she speaks perfect Portuguese. And we also Yes, I practicar mi español para ti. I practice and speak medical Spanish. And we have WhatsApp so that we can accommodate for communicating with our patients who are from Brazil, who are accustomed to communicating utilizing the WhatsApp program. And of course, our phone system, we have personnel who speak Portuguese.
Dr. Walker, what is the most important advice you give to a woman in your professional opinion?
The most important piece of advice I can give to any patient is to put your health first. That's your gift from God. You can't take it for granted. So, very important, do your health screenings. Prevention is key. Make sure you find a doctor who you're comfortable with. You can see your doctor for screening, for preventative health. Get a specialist who can perform mammograms, someone who can take care of both men and women. Very important to do the prostate screening. And also, if you could find a practice where under one roof they're able to perform cardiac screening, kidney, liver, and do preventative health, that's the best advice. Because prevention is better than the cure.
Esse é o tema da VFB Insurance. Prevention is better than the cure. Don't wait to look for a doctor, to call a doctor just when you have a pain in your chest. Because you have high cholesterol, you didn't take care. So don't wait to call your doctor when you're in a hospital. Because if you do your call, if you make your appointment every year, if you go to your doctor every year, do your prevention is the key. Call your doctor. Look for someone that's going to listen to you, that's going to help you to feel better. And this is our theme over here today. And most every day, it's for my client, it's like, always make your annual checkup.
Yes.
Do your mammogram, do your pap smear, do your PSA test, do your lab test. Make sure that your body is take care, because like I say, our life, our body is a key. Is a blessing.
Yes.
This we don't walk. We need to take care of our body.
Very important.
So I wanna just thank you, Dr. Walker. I wanna thank you so
thank
much.
you. Thank you for having me.
Time
thank
to
you
come
so
over
much.
Here.
It was an honor to be here.
And if you like this video, share it with your friends, because it's a lot of information. I know it's a long video, but we're here to help. Make some comments, and if you can help, just give a call. Would you have an Instagram, Facebook?
I do. You can find me Dr. Christopher Walker .br for Portuguese, and my Instagram title is Pepwell PEPWELL_, and I'll be happy to share my other contact information with you. My phone number is 407-333-0496, and for my concierge practice, I have a direct line for those who speak Portuguese. I will be happy to share that with you.
Thank you so much.
For your clients.
Thank you so much.
I was honored. Thank you for having me. And I hope we can keep in touch.
Oh yeah, we're gonna too.